Hello and welcome to Mississippi Insight. I'm Byron Brown. Thank you for joining us. This week we are focused on the COVID-19 surge in Mississippi. What will it take to get more Mississippians vaccinated? The White House's vaccination coordinator talks about the federal campaign to get shots into arms, and there's rising concerns about school children and teachers both exposed to the Delta variant. The superintendent from Jackson Public Schools lays out the thought process behind new virtual options for students. First thing this morning, we want to play a bit of sound from the latest gubernatorial news conference on the state's response to the pandemic. Tuesday's briefing was a very mixed bag. On the one hand, it came on the day that when Mississippi set a new single-day reporting record for deaths from COVID-19. Our state continues to have the world's worst rate of new infections. On the other hand, the state epidemiologist says that there are signs the fourth wave may be leveling off. Here's a short briefing from Dr. Paul Byers.
If we look today at our numbers we're reporting out, 3,291 additional cases, and unfortunately 111 additional deaths. Now, this is the highest total of deaths we've had to date so far during the pandemic. The previous high was back in January when we were having our large peak over the winter months. When we look at those deaths, guys, we're looking at about 87% of them are not vaccinated, not fully vaccinated. When we look at the breakdown of the deaths, more than 50% of them are over the age of 65, and a good number of those individuals, 75 and older, 75% or more, are not fully vaccinated. So we are still seeing an impact in our older individuals, and we do know that the vaccine is very protective for these folks at preventing the severe complications and illness that can occur. Now, when we look at our hospitalizations over time, we have begun to see some flattening off in our hospitalizations, in our ICUs, in our ventilator use. Today we're reporting out 1,655 individuals who are hospitalized. So that's a little bit higher than yesterday. But if you look at the trends over time, it looks like we are leveling off in the number of hospitalizations. This is the good news, and I really want to talk about some of the good things that we're seeing right now. Number one, when you look at our cases over time, it looks like we are beginning to plateau. A couple of days does not a trend make, but it does look like we're moving in the right direction with our case numbers. It does look like we're starting to have some leveling off with our hospitalizations. Certainly we've seen that with ventilator use and ICU admissions as well. But we have had some increased deaths. And we do know from our experience that when we have big surges in cases, that the deaths often follow several days later, once an individual becomes ill enough to become severely ill. And so we may anticipate some significant increases in our deaths still. We're going to watch that.
We move from the state epidemiologist to the White House's vaccination coordinator. Dr. Byron Brown was in Jackson this week to consult local officials on the vaccination effort. That effort has been picking up here in Mississippi, but at last report, we still rank 49th in the nation for full vaccinations per capita. Here's Dr. Brown with my colleagues Melanie Christopher and Walt Grayson.
Thank you for having me, Walt. Well, I'm really excited being here. I got a chance to spend time with doctors, family physicians, pediatricians, with the hospital associations, with community health leaders, with the state health department to try to see what else can we do and how we can support each other to get more and more people in Mississippi vaccinated.
Yeah. Dr. Brown, CDC says we're 49th in the country, for complete vaccinations per capita. Your perspective on this, what do you think is causing this vaccine hesitancy among certain states and certain communities?
Well, let me just start by saying that as a country, we have done a really great job in getting so many people vaccinated. We have more than 200 million people in this country with at least one shot. We have more than 170 million people fully vaccinated. But the fact remains we still have tens of millions of people in this country, including in Mississippi, who are still unvaccinated. And look, some people still have questions about the vaccines, and those are legitimate questions, and we want to make sure that we're getting people answers we're giving people facts so that they can make their informed decision. And I have no doubt when people will get those facts and those answers, they'll be more inclined to getting vaccinated.
So this is what the White House is doing now, is trying to get this information out, the proper information and the correct information about the vaccines. Anything else you're doing to try to get people to come around and see the wisdom of getting vaccinated against this COVID virus?
Well, we have to continue to put the information out for the American public so that they can get their facts and they can make their decision accordingly. We're also working with doctors across the country, and just today I spent time with family physicians, with pediatricians here in Mississippi who are rolling up their sleeves and every single day having those one-on-one conversations with their patients who still have questions about the vaccine. That one-on-one engagement with your doctor is so important, and we'd want to make sure that people are having these conversations. And look, people also trust people they know, so we'd want to continue to engage faith leaders, community leaders. We all have a role to play to get more and more people vaccinated.
Dr. Bashar, I think, when we got the Delta variant, that's what changed everything really for us, because the push was on everybody needs to get vaccinated now. So our governor, now he just spoke today, and again, would not consider any mandates of any kind, not masking, not vaccination and all, and yet he's very concerned and has been from the very beginning about keeping our hospitals open. We have 2 field hospitals open now. We have nurses and other health professionals coming in from other parts of the country to help us. We are clearly overwhelmed, and it's just continuing. We continue to have more deaths yesterday than we've had during the whole thing. What is the Biden administration's take on mandates?
Well, look, we believe that we have to lead by example. So as a federal government, we have mandated vaccinations for the healthcare workforce and veteran affairs. We now the COVID-19 vaccine will be added to the list of required vaccines for the active duty military. We're making sure that our own employees, they're attesting to vaccination status, and if you're not vaccinated, you'll get tested once or twice a week. And we do believe vaccine requirements have a role to play, and we know that employers, whether it's government employers or private sector employers, universities, colleges, all have a role to play, and we have to do everything we can to get more and more people vaccinated and protected.
So it's really important to get the employers to say, hey, if you're going to work here, we got to have you vaccinated.
Well, and we're seeing that movement happening across the country. I mean, you look at the healthcare organizations across the country.
They're doing it.
More than 250 health systems across the country with more than 2,300 hospitals are already requiring vaccines for their employees. It is one tool that we have in our toolbox. We know, we heard that from surveys, that for some people, if their employers would require it, they'll get vaccinated.
They'll do it. All
Great. Dr. Shukar, thank you so much for being here.
Pleasure.
Just as an aside, since you're going to the White House, me and Mel were talking about it a while ago. Cash incentives. That's what we want.
Hey, look, incentives work for some people, and if that's what would it take to get people vaccinated, hey, let's just get it done.
Lotteries and all
lots
of
of tools in
that.
our
That's
toolbox
right.
here. We know to use them all.
All right. Thank you so much.
Thank you so
being
much for
with us.
having me.
Meantime, the political website Y'all Politics has a new campaign promoting vaccinations. It features elected officials like Insurance Commissioner Mike Cheney. Let's listen.
You don't want to get the vaccine or wear a mask when you're supposed to. You could end up as roadkill and with COVID. Be safe. Be insured. Wear a mask. Get the vaccine. It's a no-brainer.
Commissioner Mike Cheney and his pal, the Mighty Squirrel, promoting the importance of vaccinating Mississippians against COVID-19. We'll hear from JPS's Superintendent, Dr. Eric Green, when Mississippi Insight continues. Tens of thousands of Mississippi's K-12 students have been quarantined due to COVID-19 exposure. Thousands more have been confirmed positive for COVID-19 infections. At least 6 children in Mississippi have died. All this weighs heavily on administrators' minds at the state's second largest public school district. The superintendent of Jackson Public Schools, Dr. Eric Green, briefed the district board and the public last week. In particular, he discussed the decision to offer virtual learning options for his students. Here's Dr. Green.
specific JPS COVID data, and thank you to those who have asked questions about or could not find the data on our website, and we've tried to place that in a way that you can more readily pull that data from our website. But positive cases thus far in our district, and again, this is about a day old, this data. Staff positive cases at 20. Staff who are quarantining 55 across the entire district, because they were those who were in close contact to other positive cases, whether they were staff members or scholars. Scholar positive cases, there are 76 thus far, 76 positive cases of our scholars. And we broke that out by elementary, middle, and high. It's interesting to note that the higher number and percentage of the full 76 cases amongst our scholars were found in elementary schools. And obviously that was pretty telling and startling there. Not so surprising, given that so many of our younger scholars are in closer, they don't adhere to such strict rules around private space or individual space. And so you tend to see that. And scholars quarantining. And again, as we've seen the numbers of scholars, especially in high school, who were in close proximity to others, we see this larger number of 888. And while we're pleased that there weren't any more positive cases than we had, that 76 is 76, that's still 76. And the impact to those who have been interrupted, whose learning has been interrupted, is pretty significant. In addition to the guidance from MDE and all that we've seen from the our state health officials, national health officials, we've also heard a bit from our families. We've heard from families and team members at schools. We've gotten certainly our calls, a number of calls and emails directly into the superintendent's office and to the district offices. And many of the things that we've heard are here. Now, this isn't an exhaustive list, but these are some of the major bits of information that we've received, or feedback we've received from family members and from team members. No surprise, very serious concerns about the rising cases of the Delta variant. That has come through very, very clearly. We've heard that quite consistently, even from those who believe that their children need to be in school. Real concerns about the Delta variant. There was appreciation, and we've heard this from several folks, an appreciation for our mask mandate. Whereas in other districts, there's still conversation about mandating or not mandating and whether scholars should be in masks. Thankfully, this is not something that we've really had much pushback on in Jackson Public Schools. There is concern for safety for our youngest scholars, and those, especially those who are ineligible for vaccination. And that has been, again, a consistent bit of feedback that we've received from family members and even from team members and others. Rising pediatric COVID cases and hospitalization in our area and in our state, to align with the earlier concern about our young scholars who can't be vaccinated. Concerns about family members. We've heard this from some number of folks, team members and parents whose scholars are with us in our schools. Concerned about family members at home who could be impacted by any spread of cases within our schools. And then just questions about possible vaccine mandates. We've had folks on our teams, parents, community members, local leaders, asking questions about vaccination mandates. Should we mandate vaccines for our scholars? Should we mandate vaccines for our staff members? And so, this is, again, a bit of the feedback that we've gotten. And so the proposed change to our return to learn plan, our changes are these. One, that we would continue with in-person instruction as our primary delivery model. So continue to offer in-person instruction for all of our scholars as our primary delivery model. The two, that we would allow parents the option for scholars in pre-K through 6th grade, the option to learn virtually. And that's for pre-K through 6th grade. That we'd adjust our board policy to support virtual learning. This is something that we would have to do in order to allow for this option to be granted to families. And then continue to encourage and then support all of our families and team members in getting vaccinated for those who are eligible for the vaccination. And we have some additional vaccination sites and drives planned for our scholars. Should this be approved, then we would be working to launch this virtual option for pre-K through 6th graders on September 2nd. I will note that our team really needs as much time as possible. One, to know who would be accessing this alternative option, and to plan our staffing and to ensure that devices are distributed, and just all the kind of logistical pieces of this work that would have to be accomplished in order for us to launch it with any level of success. And our team is really determined to do this and do it well, and not just be thrust into a new way of operating. And so we would need a little bit of time, at least, in order to operationalize this. And then we would operate this virtual learning option through December the 21st, which is the end of the first semester, at least. And obviously at that point, we would be continuing to consider what does this look like for what does the data look like, and does it make sense to continue with this option?
You can find more information for parents and educators alike at JPS's website. We're back with more Mississippi Insight in a moment. And welcome back. When the governor's office announced a news conference last Tuesday morning, it was nominally focused on the pandemic. Yet Governor Reeves had more up his sleeve that day. He touted his proposal to eliminate the state income tax.
Today, Mississippi stands in the best fiscal shape and the best financial shape we've ever been in, thanks in large part to Mississippians' willingness to go back to work despite this global pandemic. Thanks to them, Mississippi ended the most recent fiscal year over $1 billion above original revenue estimates. As Lieutenant Governor, I was proud to propose the largest tax cut in Mississippi history. We were able to get that done, eliminating the 3% income tax bracket without increasing anybody's taxes. We did it before, and it is my firm belief that we can do it again. Now is the time to get this done. We can no longer kick the can down the road when it comes to getting rid of the income tax.
Lawmakers began discussing such proposals in Jackson this week. 12 News' Tao Ta filed this report.
Lawmakers looked at tax reform during the legislative session. Now discussions continue with potential income tax cuts back on the menu. Talks about phasing out the state income tax ran into a second day at the Mississippi State Capitol. House Speaker Philip Gunn is out in front on the issue. He's long supported ending the state's income tax.
Well, I think this is a very positive 2 days because it shows the House and Senate working together to try to get information to develop a positive plan.
The debate was heated at times, with both sides hoping to find some kind of common ground. Democratic Senator Hot Bryan opposes the effort.
Is it your goal to shrink government?
No, it is not my goal to shrink government to where it disappears, okay? It is my goal to have the government grow more slowly so that it becomes half as expensive to people over a 25-year period. That is my goal.
Lawmakers debated how far to go with the income tax.
There's ways we can improve the House bill. We want to do that.
Mississippi remains one of the nation's poorest states. Democrats want to know where the money is going to come from.
We're not a cash-rich state. We don't have a overwhelming majority of our population is being wealthy. We need a certain level of government services. And
Lieutenant Governor Delbert Hosemann made an appearance at the hearings. He has said he expects some kind of tax cut. Now, Governor Reeves has made eliminating the income tax the centerpiece of his budget, but he made it clear in a news conference earlier this week that eliminating the income tax doesn't mean that other taxes should be increased. Back to you.
That's Tal Tal reporting. The Nonpartisan Institute on Taxation and Economic Policy says removing the state income tax could be an economic disaster for the Magnolia State. And they warn it would further shift the tax burden from rich Mississippians to poor Mississippians. A final word after the break. Our thanks to Dr. Bashar Shakir and our own Tal Tal for their contributions this week. We'll be back next weekend with more of the political and current affairs coverage that you demand. I'm Byron Brown. From all of us here at 12 News, make it a great weekend.